Welcome to COIQ, where you learn how health innovators maximize their success. I'm your host, Dr. Roxie, founder of Legacy DNA and international best-selling author of How Health Innovators Maximize Market Success. Through candid conversations with health innovators, early adopters, and influencers, you'll learn how to bring your innovation from idea to startup to market domination. And now, let's jump into the latest episode of COIQ. Welcome back, COIQ listeners. Today we have Ruchin Kansal with us. He is the founder of Kansal Consulting. Welcome to the show, Ruchin.
Thank you so much for having me.
It's great to have you here. So I always like to start off with having you tell our listeners and our viewers a little bit about you and your background and what you're up to these days.
Oh, that's a loaded question. So, I've gone through a few pivots in my life. I started out as an Air Force pilot who became an architect who decided, it's not enough to pay my bills. So I got my MBA and then, just got into management consulting and healthcare by chance. And then I spent almost 10 plus years in management consulting, first with Ernst & Young, Capgemini, and then with Deloitte, focused on healthcare and advising pharma companies globally, either on launching companies in different markets and or growth strategy, commercial model transformation, market access, reimbursement, all the good stuff. And then, decided to move on to the lighter side or the darker side, depending on who the audience is, into the industry itself. First as a person in charge to think through the whole innovation and transformation of the biopharmaceutical industry, which was my role at Boehringer Ingelheim, really helping the company get ready to figure out how it can remain relevant in the future. And after that, I was the senior vice president for digital services at Siemens Healthineers. And there the role was again about thinking in terms of how we can launch digital products and services to enable the future of healthcare. Mm-hmm. And somewhere in between, I ended up writing my first book with my co-author, and it is called Redefining Innovation, and it really looks at how the industry, the healthcare industry, can really, redefine itself to become a lot better for the patient, and talks about how it can get there. And right now, I'm, doing consulting of my own, working with healthcare companies on their innovation and transformation roadmaps, and also coaching leaders on how to really embrace change.
You've got a very broad and deep background.
Well, I've been privileged for sure. Thank you for that.
Yeah, absolutely. And congratulations on the book. I can't wait to get my copy in the mail.
Well, it should land next week sometime. I direct ordered from Amazon.
Perfect. So you mentioned something that just is so poignant for this particular moment in time. You talked about helping organizations figure out how they can be relevant in the future. Mm-hmm, mm-hmm. And I think that is a phenomenon that is important all day, every day for a business, no matter what the climate is. Mm-hmm. But wow, isn't it even more poignant today during this global pandemic? Mm-hmm. And where I think a lot of companies are evaluating their relevancy in the new market, where prospects and customer needs have changed and priorities have changed. How do you think that this pandemic is affecting innovation in healthcare?
So let's first talk about what's constant about healthcare, right? So what's constant about healthcare is there is a patient, a person who needs to be taken care of. And then there is the whole healthcare system that is hopefully designed to take care of the patient in the best fashion. And it's not about the system, but it's about the patient. At least in the US, I think we have become more a business of healthcare than being in the business of solving for health of the patient. And, even before the pandemic, we were seeing quite a bit of external disruption that had started to happen, either from outsiders who saw a big opportunity in healthcare to really disrupt the system as is, and or technology companies looking to bring in more efficiency, et cetera, et cetera. And I think what the pandemic has done, it has really, number one, disrupted the objection that healthcare cannot change because it is what it is and this is how it is done, right? I mean, things like telemedicine was, you can't really do telemedicine, but now we are breaking barriers to do telemedicine. Physicians were not allowed to practice beyond state boundaries. Now they are doing that, right? So when the urgency came, we broke the barriers we always said we cannot break. And we are actually embracing new ways of delivering care. So I think, that is a good thing, and it will continue to really evolve even beyond the current situation and accelerate some of the change. But now going back to, will it really stick? That is a different question, right? And then there, I think it comes down to leadership and how the leadership will embrace this change. I always say the CEOs of today are the kings of the past.
And right? I love that.
It's not that we don't want to change, and it's not that we don't want to do the right thing, and it's not that, we don't see what the future could be, but number one, as individuals, we have lizard brains, right? Darwin's theory tells us that we have lizard brains. We want to maintain the status quo more than we want to embrace change. And once we get beyond this crisis and then this whole idea of innovation, we may most likely fall back into let's do business the way we have always done it. And we may survive with that for some time, but it is also an opportunity to really say, hey, we can survive, but maybe we can do things differently now. And to do that, I think we first need to, as leaders, think about what's our risk appetite for change. Can we really embrace change? Can we really drive change? And then I think, that will be the key factor, because the rational part is easy. The emotional part is difficult.
Absolutely. I think that there are so many people, so many leaders that are, whether we're in denial still, but still going through this grieving process in a lot of ways of what was.
Mm-hmm.
And, I think some people, let's just say even a few weeks ago, were like, just waiting for this to get over so they could get back to how things were. And I don't think that's going to happen. I think things are going to be different. We'll have a new normal.
We should have a new normal. It's not that we will have a new normal. We should have a new normal. And I think we should really embrace that opportunity to create the new normal. And we can do that in a very planned, rational way, right? And we need to assess how much risk we can take. We need to assess what investments we can make. But we do need to think about what do we need to do today, right now, to take care of our COVID patients and, the electives. We need to really think about what we need to do to keep the business going in the midterm. But then we also need to figure out all the lessons we have learned in this compressed period of time and figure out how we really start to create that future a little bit longer term. So if we can begin to lay it out in a planned manner and make planned investments to get there, I think we'll be foolish not to really embrace this, because I tell you, there are people who are going to embrace this and just start to really do things differently. And for the incumbents who don't, they will survive, but for how long, I don't know.
Yeah, absolutely. We talk a lot about on the show, at least over the last probably 7 or 8 weeks, about pivots, and, everybody kind of has their own pivot story that's unique to them. And, what I hear you saying from, some of our previous conversations, and even what you're saying now, is that, for any organization to really have a successful pivot strategy, it really starts with the leadership pivot at the top and that mindset change. Talk a little bit about that. What do we need to see happen with leaders, as a whole?
Yeah, so again, it comes down to, number one, realizing that pivots can be a good thing. Now, a pivot doesn't have to be a pivot of everything that we do. It could be a
Right.
pivot of few of the things that we do, right? For example, in pharma, we might be thinking of a pivot of the sales force today, right? And
Yeah.
forever we have had people calling on doctors, but they're not calling them on them now in person. And maybe we'll pivot into a digital promotional model finally. So the number one is, as people, we need to realize that pivots are possible. Number two, pivots don't mean that we have to change everything that we do today. Number three, that pivots can actually yield better financial results, better customer interactions, and better employee engagement.
Yeah.
And if we can keep those three things in mind, and we can really, be conscious about in our minds what are the barriers to really achieving that, and how we can prevent ourselves from falling back into the same old behaviors, we can achieve that new future. And I think that's where, this whole idea of being conscious about what you really are and what you're thinking and what you want to do, really finding the true purpose, not just of yourself, but your organizations and yourself, and how that aligns, and really aligning the purpose of whole organization behind it becomes more important, because change is not easy, pivot is not easy, and if you're not aligned to that vision and purpose, it will fail.
So, you know what it reminds me of? This book that I read years ago, a long time ago, called Who Moved My Cheese?
Mm-hmm.
Right? Corridor C, him and Haw, right? My gosh, I feel like I'm dusting off the cobwebs here.
It is true. I mean, I think it's also, as we mature and as we look through things over time, we also start to realize that, it is good to reflect and do things purposefully.
Yeah.
And part of that reflection also yields the fact that, maybe what we are doing today is not right. I mean, a lot of times, hopefully it is right, but sometimes we may discover that there is someone who may move our cheese if we don't. Again, talking of healthcare.
Yeah.
I know China is a boo-boo right now. Nobody wants to talk about China. But one thing that they did, even before the pandemic hit, was they really started to embrace the digital healthcare model. Companies like Ping and companies like Alibaba, Tencent, right? And they, because they did not have an infrastructure that they could depend on. So when they started to build, they built a digital first model.
Yep.
And it works. I mean, Ping An has about 700 million subscribers versus 100 million that Amazon has, and they're providing them all kind of services. So it works. We are trying to build that now. We could learn from that and build a better system. So why not?
Yeah, absolutely. Well, and I think that that's some, I hear a couple of lessons in what you're saying here is, one, don't be afraid to leave what was, because what's in corridor C or corridor M right around the corner is, can be a whole lot more cheese. It can be a lot better. So for whatever good we thought we had it, who knows what's on the other side of that. The other thing that I hear you saying is that, as entrepreneurs and innovators, I think we have a tendency to move fast. And in a lot of ways, there's a lot of value to that, right? It helps us get to market fast and maybe usurp the competition and have a vision for what the future could be. But I also hear you saying that there's some benefit in slowing down, pausing for a moment, and really taking the time, doing due diligence to reflect.
It doesn't always have to be go, right? Because that may not be always good. And frankly, the fact that some of these businesses have done so well for so long means there is something that works right.
Yep.
Just saying that, throw everything out of the window and we just need to pivot and we just need to move, that's not right either.
Right.
So we need to be pragmatic. We need to have the right pace, but we also need to realize that we need to be moving forward. Again, you talked about taking risk, and maybe corridor C may be better than corridor M. Again, I mean, I said this in my introduction, but just my personal pivots in life, right? So I was an architect, right? And I was doing fine. I was building theaters. They're still standing. I had a secure job. And one day I decided I'm just going to leave that and get my MBA. And not knowing anything about MBA or banking or consulting or everything that people know about when they go to do an MBA.
Yeah.
As I reflect back, had I not done that, had I not taken that risk, had I not taken that step back and taken a loan, would I still be employed as an architect? Absolutely. Would I still be building things? Absolutely. Would I have really, achieved the same income? So financial returns that companies look for? Probably not.
Yeah.
I took that risk, experimented, took a chance. I turned out to be a lot better and a lot more privileged in that. And now that allows me to take more risks and more pivots. So it's scary. I can tell you how scary it was for me, how scary it was for my wife, how scary it was for my family that I'm leaving a job and taking a $100,000 loan. But ultimately, it's all good. So sometimes you just have to take calculated risks, right?
Yeah.
And take that chance. And not every pivot is a bad pivot.
Well, and so I think that's another lesson, right? So not every pivot is a bad pivot, but not everything don't need to pivot everything. And I think that's a point worth emphasizing too. I think what I advocate for is that as leaders, as business owners, we all need to sit down and at least analyze that. If we end up through a very thorough analysis and going, you know what, my business model works really well. There's no new opportunities in the changing market conditions, and there's nothing we need to change. That's fine, right?
Yeah, absolutely. Yeah, you don't have to be always, in the process of go, change.
Yeah,
but change when it makes sense.
Hey, it's Dr. Roxie here with a quick break from the conversation. Are you trying to figure out what moves you need to make to survive and thrive in the new COVID economy? I want every health innovator to find their most viable and profitable pivot strategy, which is why I created the COVID Proof Your Business Pivot Kit. The Pivot Kit is a step-by-step framework that helps you find your best pivot strategy. It walks you through 6 categories you need to examine for a 360-degree view of your business. I call them the 6 critical pivot lenses. As you make your way through this comprehensive kit, you'll be armed with the tools, tips, and strategies you need to make sure you can pivot with speed without missing out on critical details and opportunities. Learn more at legacy-dna.com/kit. So let's talk about something else that you mentioned, a sales pivot, right? So biopharma, specialty pharmacy, med device. We can just probably rattle off a whole laundry of companies that had traditionally relied on face-to-face outside sales teams, and really, in a lot of ways, haven't embraced social selling to the degree that a lot of other industries and a lot of other sectors have, and so I think a lot of those entities are a bit still in shock. What do you see happening?
Yeah, no, I mean, I think again, like many other things, the writing has always been on the wall, at least for the last 7 to 10 years, that the commercial model, especially the biopharma commercial model, which was based upon a sales rep calling onto the doc, was not effective, right? However, given that business model is so good and so profitable, I mean, in our book, we talk about it as the unicorn business model, right? Unicorn industry. Even though the writing has been on the wall, people have been hesitant to really get away from it, right? Even though there have been some cuts, nobody really gave up on it. And the industry is really about, I'll move last, not I'll move first.
I'll move when I can't stay where I am.
Exactly. And so everyone has been maintaining those sales forces. And now that for last 2 months, everybody has been sitting at home and doing video calls when possible, and or not even that because docs don't have time. People are asking the question of what do we do with the sales force? And I mean, nothing about the sales force or the sales people, right? I'm not talking about that. I'm just talking about the model here.
Yep.
But people are really scratching their head, and I mean, they need to think about how can they either rethink the value of their talent that sits in their sales forces, and or think about retraining them to sell virtually, and or think about how else they can really help with the promotional model. So this is a hypothetical for a minute, but and this is something that had come up when I was running the innovation group at Boehringer. We were working quite a bit with insurance companies, and we had these strategic partnerships, and it's all in news media, so I'm not sharing anything that's not in the public realm. But we had these partnerships, and through these partnerships, one of the questions that came up was as we got into value-based care, insurance companies were really trying to call on doctors to help them figure out how to provide value-based care, right? How to achieve their metrics while deploying value-based care. But they never had called on doctors.
Mm-hmm.
Pharma companies had always called on doctors. So we knew how to call on doctors. So one of the conversations that happened was, can a pharma company actually become a trainer for insurance companies as to how to call on doctors?
Ah.
So, there are ways to really think about how do you redeploy the talent that you have as things are changing. And like I said, in this case, really assess if the person-to-person sales model is something that's gonna survive the pandemic, because most likely with everyone saying don't see me in person, it may not, and after some time people have people get used to doing things in a certain way after some time, and so they may not want. So really think about what do you do with this talent, and number two, how do you develop these social selling skills and digital selling skills, et cetera, et cetera. I mean, I feel for the sales forces.
Yeah.
But really, we are at that point right now.
Like overnight, right? I mean, I think from their perspective, the conversations that I'm having is like, what the hell happened?
I mean, if I were in their shoes sitting right now, I'll be like, oh shit, right? I mean, sorry for that word, but
no.
It's not them.
Right.
And they put their heart and soul into it, just like, many others, airline pilots, flight attendants.
Yeah.
But a lot of those jobs may not come back.
So we kind of have this, what I would call traditional outside sales model. And then you've got this virtual sales model. What are some of the things that you think haven't changed? Like really, like fundamentally, whether you're selling face-to-face or whether you're selling online, these things haven't changed. And then what are some of the things that you think definitely have changed?
Right. So I think what has not changed is the need for conveying information, and conveying it in a robust fashion, which is scientifically astute and scientifically robust, right? So that has not changed. Doctors do need to learn about products and services, and so that piece has not changed. What has changed or is changing is how you convey that information. Right. And so that's one. Number two, the need for demonstration, right? So let's think of medical device or diagnostics companies that make a CT scanner or something like a instrument that is used in a surgery or whatever. So the need to demonstrate how it works, the need to train, the need to really install it, deploy it, maintain it, that has not changed, at least not right now. But how do you do that? It may, right? Because some of those pieces may be possible to do without the need for person-to-person interaction. So I think breaking down what are you selling and how are you selling it, and what pieces of that sales process still need to be physical, and what can be done more virtually, digitally, et cetera, et cetera. I think that'll be a good way to really figure out how you begin to reassess and redeploy
Yeah. Yeah, absolutely. So, I think that fundamentally sales is about relationships, right? And it's about meeting unmet needs. And that hasn't changed, right? But like you said, how we go about that, a lot of the tactics have changed. One of the things that I'm starting to observe over these last couple of weeks is it almost seems like there's a little bit more of like the social media engagement and the virtual selling that is illuminating more publicly what the sales reps were doing.
Mm-hmm.
So like maybe on the face-to-face model, I really didn't have exposure except for, did you make the sale? Did you close the deal? Like number of visits and did you have a number of sales? Whereas it seems as though when we're taking some of those strategies and tactics to the digital realm, that there's a little bit more public view of what's happening. And I think that some of the gaps in the strategy know-how or tactics is being illuminated, where maybe there would have been some assumptions around reps understanding that, I'm taking someone through a journey and I'm going to provide certain value up front before I ask for the sale. And then you see that happening digitally and they're skipping the first 15 steps of courting.
Yeah. No, I mean, I think you made a very valid point there. The classic definition of sales sales success has been defined by the strength of the relationship.
Yeah.
Now, you're absolutely right. In a virtual model where there wasn't a pre-existing relationship, right? If there was an existing relationship, you could still potentially maintain it. That trust factor that comes because we're humans. But in a virtual model, that whole idea of how do you create a relationship and how do you create trust is the question that you really need to ask. If you agree that sales is really about creating that trust, that creates the sale. In fact, a few weeks ago, I had a chance to speak to the students at Seton Hall, their leadership institute, and we talked about this exact thing more from a leadership perspective. And the thing we talked about is, if leadership is about creating trust, how do you create trust in a virtual environment? Because in a physical environment, people see you, people see how you act, people see how you empathize, how you communicate, and they see you as a person in person. It doesn't happen in a virtual world. So how do you become a leader in a virtual world? And after a lot of discussion, where we landed was, it's not that different. It is still about being genuine. It's still about communicating. It's still about the touch points. It's still about being empathetic about what the other person is trying to say and do. And it's about responding just in different ways. So yes, I mean, it is going to be an adjustment, but you can create those relationships virtually. And then that's, I think we should try to do.
Yeah, absolutely. I think, communicating, whether it's through video, personalized video messages, video content, value videos, having that type of vulnerability and transparency. I think that, if you and I were sitting face to face, part of the way that we would deepen our relationship is we would tell stories and we would be honest about different things in our life. I'm not going to sit down with you and I'm not going to tell you all the skeletons in my closet on our first conversation, right? But I'm also not going to act like I'm perfect, and I'm going to be real and just kind of share my life with you, not just the business aspect, but just as a human being. And I think that, maybe that's one of the barriers that we need to break as we move towards more virtual selling, is to, to not have to be so perfect and so polished. And that, for whoever has the courage to be transparent and to be vulnerable, I think that that's a pretty strong sales strategy.
It is. And look at it this way as well, right? I mean, maybe right now I'm the sales rep, right? And I'm feeling like I'm not able to, and let's say you are the doc for a minute, and I might be feeling, hey, I'm not in the doc's office, I'm not in Roxie's office right now, and I'm not able to speak with her face to face. and how will I build a relationship? But you as Roxie may be thinking, this poor guy, he's sitting there in front of his Zoom camera, and you may already have some empathy with me.
Yeah.
Right. So it's not that, we are the ones who are really falling down. The whole world is adjusting. So so I think we should have faith in everyone. We should trust, that the other person also in general has the good of the world in their hearts, and then they understand and they empathize as well. And then, they know what our barriers are. And if we can solve their needs, whichever way we can, we will build trust and we will build empathy, and that'll go a long way.
Yeah, yeah. Well, and I think to your point, that's one of the things that makes this particular season so unique, that I think then from any of us have experienced in the past, is that not even just in the US, but really almost around the world, like we're all experiencing the pandemic in different ways, but there is definitely a sense of unity and solidarity because we are all experiencing this pandemic in some form or fashion. So I think that you're right. It's not just one company. It's not just, this sales team or these physicians. It's all of us. So that empathy makes a lot of sense. And it seems like it makes it a little bit easier to be vulnerable and empathetic. Right.
Yeah. I mean, absolutely. I just can't add anything more to that. You said it perfectly.
Yeah. So what are, when we think about the tactics, do you have any lessons learned or any recommendations of any specific tactics that you think, our listeners could heed as they're transitioning into this, virtual sales pivot, things that they could try or that they should consider in their new sales strategy and toolkit?
Yeah, so I mean, let's assume that the next sales call is going to be virtual call, right? So I'm just going to assume that for a minute. So there is this technique called framing and reframing that's out there, and framing is just think of it as one perspective, one view of the world. And typically, that's how, if we have been a sales rep before and now that we have this opportunity to make a call on the doctor virtually, we may just want to do the same thing. But a reframe could be that, we are going to be on video. And yes, I have to deliver this message, but, the doc may be feeling some other anxieties and or other things in life. And yes, I mean, you have to remain within your regulatory and compliance, frameworks. But at the same time, just reframe the situation. Think about, what their needs might be at this time, and how else can I help them, right? Because that may be how you start to create trust and empathy in relationship. In this case, so just frame and reframe in terms of what else and how else can I look at the situation differently, and how else can I, add value in the situation.
Yeah.
It'll be different in every case, but I would say that is one thing all of us can easily do.
So, that is so important because, we know this to be true. Like intellectually, we all know that if you are going to be successful at sales, it's not going to be about telling. It's not going to be about vomiting on someone and telling them all your features and functionality, right? And we know that. But it still seems like that's a really hard habit to break. And what you just noted is just the simple idea of asking someone what I would call a power question. And everybody's needs have changed. So just starting off with, how can I help you?
Exactly.
Right.
How can I help?
How can I help you?
Yeah.
And you probably aren't going to, let's say that you're talking to that doctor every week, you're not going to get on the phone with him going, hey, how can I help you? Right. And then the next week, hey, how can I help you? Right. It's got to be, natural and conversational. But I also think at the same time, we can rephrase that and we can ask that in a different way every few weeks, because things are so dynamic right now that how I help you right now might be different than how I could help you in 3 weeks.
Absolutely.
Yeah.
Absolutely. Like I said, yes, you have to be very careful about especially in pharma and or regulated sales models about that you don't step out of bounds and do
I
things.
cannot help you with a trip to the Bahamas. I cannot help you with a Rolex.
But within that, even in terms of how you provide information and or follow up, etc. I mean, there are things that can be done.
Yep, absolutely. And I think to the point that you're making too, is that how can I help you could be some just intangibles of like listening and empathizing. And that could maybe go a long way than, a piece of collateral.
Imagine the doctors on the front lines and how panicked they are and the personal cost of the impact on their families. Where my wife is a physician, she for the last 8 weeks has been living in a separate part of the house because she does not want to expose myself or my son to anything she might bring from the hospital.
Yeah.
And they're human beings.
Really? No. Of course, yes.
Don't think of them as biased. Think of them as beings. And then reframe.
Right. Exactly. So, we've talked about the leadership pivot. We've talked about the sales pivot. Is there anything else, any other lessons learned or wisdom that you would want to share with our viewers and listeners today as, healthcare leaders, healthcare entrepreneurs are trying to navigate this new COVID economy?
Number one, don't be anxious, right? Because right now, anxiety is something that we are all dealing with. Number two, the human race has come so far. It still has a lot of distance to go. So I will not for a minute undermine my faith in human beings and their ability to survive and create and get over things. Number three, just reflect. And reflect, reconnect, and think about what's possible. Like I said before, you don't have to go. Nor do you have to change everything. But at the same time, there is enough opportunity right now that we collectively can do things that will make healthcare better for all of us. So
I'm so glad you said that
twice.
I'm so glad that you said it twice, that we don't have to go. Not for our listeners, because I need to hear that. Over and over and over. Because there's so much more to do right now. There's, so many more ways that we can help. And, our strategies and our plans that we had laid out for, this quarter kind of was thrown out the window. And now we're re-strategizing and replanning everything. And so it's just, I'm so glad that you said it twice, because I think it's just really good to re-emphasize that.
Yeah. Take a pause. It's all going to be good. Take the opportunity, really.
Yeah. Well, thank you so much for sharing your wisdom with us today. How do our listeners get a hold of you if they want to follow up with you after the show?
Yeah, so certainly you can email me at ruchin@kansal3c.com. I'm on LinkedIn under Ruchin Kansal. My website, Kansal & Company, is kansal3c.com. I look forward to really connecting, hearing from you, continuing this conversation, and hopefully we can do things together.
Yes, that sounds great. Thank you.
Thank you so much.
Thank you so much for listening. I know you're busy working to bring your life-changing innovation to market, and I value your time and your attention. To save time and get the latest episodes on your mobile device automatically, subscribe to the show on your favorite podcast app, like Apple Podcasts, Spotify, and Stitcher. Thank you for listening, and I appreciate everyone who's been sharing the show with friends and colleagues. See you on the next episode of COIQ.